you guys know, since Trump's been in office, one of the things he's trying to repeal is the Affordable Care Act, or commonly known as Obamacare. I personally think that we should keep Obamacare intact because we need to expand access to healthcare insurances to the people, and it also support and protects patients against arbitrary actions by insurance companies, which also means like people with pre-existing conditions, and to help Americans save money on medical costs and needs. So the first supporting claim would be to able to expand the healthcare to people across the nation. From the Forbes, I read an article, it said the Affordable Care Act was intended to create a uniform Medicaid eligibility level and income definition across all states. Medicare's guaranteed benefits will not be cut, but the reimbursement rates paid to healthcare providers for some services will be reduced. Part of Obamacare is, and Medicaid is providing insurance to people with lower money, with job resources. And the Affordable Care Act enables the young adults to remain as dependent on their parents' healthcare insurances until age 26, and recent evidence suggests that as many as 3 million young adults have gained coverage as a result. So I know most of you guys aren't 26 yet. I remember you asked people raise their hands to see who's 26. But when you turn 26, you're gonna lose your parents' health insurance, and Medicaid helps you get insurance and be able to be seeing doctors and help reduce likeliness of being in the hospital in the future. The second claim would be the United States has to support and protect patients against arbitrary actions by insurance companies. So this is more towards people with pre-existing conditions. The Affordable Care Act has offered this protection for children with pre-existing conditions since September 23rd, 2010. Insurance cannot deny coverage to children due to their health status nor exclude coverage for pre-existing conditions. This could be for mental health care, for diabetics, probably anemics. There's a lot of healthcare that needs insurance. The Affordable Care Act will provide one of the largest expansions of mental health and substance use disorder coverage in the generation. Beginning in 2014, under the law, a new small group of individual market plans will be required to cover 10 essential health benefits categories, including mental health, substance disorder services, and will be required to cover them at partially Medicaid and surgical benefits. That was provided by the Children's Mental Health Network. People take insurance for granted. I myself am a type 1 diabetic, and when I got kicked off my parents' insurance, I went to go pick up a prescription that I thought was covered. They didn't charge my new insurance for 3 bottles of Novolog, which is a requirement for me. I needed like 75 units a day. They were gonna charge me $700. And with my insurance, it reduced the cost to $30. So I'm sure as like a college student, you could see that's a very big difference. My third claim would be the Affordable Care Act helps reduce costs of medical needs. That could also be backed up by what I was saying earlier about just even test strips. For a vial of 50 test strips is $50, so that's $1 test strip. When you test your blood sugar 4 times a day, you're gonna go through that pretty quickly. A quote, healthcare expense is covered if your plan benefits are applied to the item or service. In contrast, if an expense is not covered, your plan benefits will not be applied. That is, you will be responsible for 100% of the cost and nothing will count towards meeting your plan or deductible out-of-pocket limit. If an expense is covered, you might still be responsible for 100% or a portion of the cost, but any amount you pay will count toward your deductible of home insurance. So when you have Medicaid, you pay the $500 deductible, and then most of everything beyond that is going to be covered, but obviously the copays. Starting in 2015, over $6,000 of the annual limit for all individuals out of cost pockets, including copays, deductibles, and co-insurances will be covered. So the reason why it's important to have health insurance is for those rainy day situations or those what ifs. If you're in a car accident and you weren't insured, you'd probably be charged up to $100,000. I know ambulance rides are close to $1,000 one way. You may not think you need it now, but one day you probably will need it in the future. So that's why I think it's good to keep the nation covered.
All right, well, the proposition's identified, but as it's phrased, it's a claim of policy, so that's a little bit problematic. You do have a preview, but you rushed through it. There isn't any numerical signposting, and the only reason that I knew that it was the preview is because you went right to the first of the supporting points, and that was the same term or concept that you had in the preview. So you got to pace yourself a little bit in that opening. The presentation is reasonably well organized internally. You've got 3 points that you're dealing with, so they're easy to follow. The information on the first point talks about what the objective of the law is, but there's not any demonstration that it is particularly effective. The one thing that you have here that applies is the 3 million young adults who might be covered up to the age of 26 by their parents' plans. There's not any explanation about why that is better than getting their own plans, why it's cheaper or how it's cheaper. So I think that you need a little bit more on that particular point. On the second point, when you were talking about problems about arbitrary coverage, you don't have any examples of that. You just talk about kind of hypotheticals, what could happen in a particular set of circumstances. You do have some personal examples that you're using on that point, which I think is pretty effective at building some credibility, but that's about as far as it goes. And we're back to the situation where the question then becomes, you mentioned that this is supposed to happen in 2014, both the mental health issue in 2015 for covering of other items and after $6,000, and that's 3 and 2 years ago. So how has it been effective? We should have some data on the information at this point, and we don't really get anything except what the plan is supposed to do as opposed to what it has accomplished, and I think you need to have that a little bit more. The third point, again, also talks about what the goal is, how it's supposed to work. There's an explanation about how costs come up, and then you kind of have the what-ifs scenario at the end, hypotheticals, which I think are reasonable. How is the coverage under the Affordable Care Act more complete, more widespread, and more effective than the coverage that existed before the Affordable Care Act? There's not any data that makes that comparative information available to us, and I think you need that to make your argument work a little better. All right, thank you.